All right. Hello, everyone, and thank you for joining us for our webinar today. We will be covering patient-centered medical home and patient-centered specialty practice, a clear roadmap for practice transformation. So before we dive into this topic, there's just a few housekeeping items I want to review with you all really quick. If you have any questions at all during this presentation, feel free to type them into the Q&A box, and we will answer those at the very end. Your lines have been muted, and we are recording this webinar, and we will send that out to all registered attendees in the next couple days. So on the slide, you'll just see our disclaimer. The information contained in this presentation is for general informational purposes only. The information is provided by UK Healthcare's Kentucky Regional Extension Center, and while we endeavor to keep the information up to date and correct, we make no representations or warranties of any kind, express or implied, about the completeness, accuracy, reliability, suitability, or availability with respect to the presentation content. Here at the Kentucky REC, we do offer a variety of services. Those are listed on the slide. If there's anything that you need help with or have any questions on, feel free to reach out to us. We will provide you our contact information at the very end. Here at the REC, this is our PCMH team. So I myself am Kristen Gardner, and I will have Vance Drakeford on this webinar as well. So the objectives for this webinar, we want to cover the patient-centered medical home recognition and accreditation programs. We'll discuss the foundation of the PCMH and then also the patient-centered specialty practice. We will give you program overviews. We will also provide you with some goals and benefits of these recognition programs and why you might want to obtain that recognition. And then we will cover the Kentucky REC assistance and what we can provide for you. So first, let's talk about the patient-centered recognition and accreditation programs. So there are 4 different types of these programs in which you can receive that patient-centered medical home recognition. You'll see that there's the Joint Commission, the AAA-HC, URAC, and NCQA. And so really here at the REC, we choose NCQA because it's the gold standard among these programs. It's also the most popular and has the most number of recognized practices, and also CMS lists them in the macro final rule. So let's provide you with some foundation of patient-centered medical home and patient-centered specialty practice. So what is a patient-centered medical home? It's not actually like a physical location necessarily, but it's really a model of care in which a practice emphasizes care coordination and communication to really transform primary care into what patients actually want it to be. And so then we have the patient-centered medical neighborhood. PCMH is the first piece in the puzzle, but what happens once that patient actually leaves their PCP's office? To really have that true transformation in how we care for those patients, we must zoom out and look at the bigger picture, which is what we refer to as the patient-centered medical neighborhood. PCMH is not an end unto itself, which is why we need the entire healthcare system participating and providing that same well-coordinated and patient-centered care. And so like I mentioned, then you have your specialists. So you have the patient-centered specialty practice recognition, and that's because healthcare does not just stop at your PCP's office. So that is why they have created this specialty recognition program. And those standards are really built on the success of the patient-centered medical home standards and make NCQA recognition available to several different specialties. And so both of these models are built from the foundation of the triple aim, which was developed by the IHI. And so that framework really just includes improving the patient experience of care, which that's when you look at your quality and satisfaction. There's also improving the health of populations, and then reducing the per capita cost of healthcare. And we'll talk about some of those costs and reducing those later on in the slide. So on this slide, as you can see, this is really showing how the models were developed through the years and how they have become more patient-centered. The PCMH and PCSP programs incorporated aspects from each of these areas through the years, which has actually brought us to today's medical home model. The programs for both of these programs are really set up as a roadmap, and they are there to guide your practice towards transforming into this model of care. And really what you end up transforming into is really having, you want to develop those long-term, meaningful patient-provider relationships. You'll see that care that is coordinated among each provider. There's better access through expanded hours and possible online tools for patients. There's better shared decisions so that patients can make informed choices and really get better results. There are goals to have lower costs from reduced ER and hospital use. And then also higher satisfaction among patients and providers. And currently there are over 15,000 PCMH and PCSP NCQA recognized practices in the United States. So as you can see, it is a pretty popular recognition program. So now I want to pass it over to Van Strakeford, and he will give us some program or go through the program overview for us.
Well, thank you, Kristen. Good afternoon, everybody. Thank you again for joining us for this webinar. So I'm going to be talking about the different program overviews of PCMH and PCSP. Kristen's given us a little bit of a background on patient-centered medical home and specialty practice, how it kind of got started and how it kind of has evolved over the years. So as we look at our next slide here, we're talking about the program lingo. So what does that mean? Well, when you start into PCMH or PCSP, you are going to have standards and guidelines. So these are the requirements that NCQA has established in order to achieve recognition. So we wanted to kind of show you what these standards and guidelines look like. So there's some lingo that we like to say involved with this. So you have concepts, and really concepts are just the overarching components of PCMH. And then under concepts, you're going to have what they call competencies. And this is just a different way to think about the major concept area. And then they kind of deduct that and go into what they call criteria. These are individual tasks or things that you have to do in order to complete that NCQA requirement to become recognized. So to kind of illustrate that, we wanted to give you an example of the actual standards and guidelines that's in PCMH. This is team-based care and practice organization. And this looks exactly the same for PCSP as well. We just used the example from the PCMH standards and guidelines. So the very top portion explains the intent of the concept. This concept is team-based care and practice organization, and they abbreviate that with TC. And directly beneath that concept, we can see the competency. And finally, underneath the competency, after he gives a description of the competency, you're going to see some criteria. And you'll notice that some of the criteria have core beside them, and others have a credit value beside them. And so we're going to discuss what that actually means in the next couple of slides, core and criteria. So for PCMH, these are the 6 different concept areas that are embedded into the actual program. So let's talk about what each of those actually have inside of them and what kind of things that you were looking at for these different areas. So for TC, which is team-based care and practice organization, this really dives into, your practice leadership the different care team responsibilities, and kind of orienting your patient and families and caregivers, how you're going to do that. How's your practice really going to partner with your patients and your families in order to have the best care available? Now, the next concept is knowing and managing your patients, and this deals with how you collect data. So your med reconciliation, your different demographics, any type of evidence-based clinical decision support, CDS rules that you have embedded in your EHR, that's all going to be into this separate concept. AC, so this is patient-centered access and continuity, and this is really what kind of access does your practice provide to your community, to your patient population, and how do you give clinical advice during business hours, after business hours, how you're going to have that continuity of care for patients, and also impaneling your patients. So do your patients have a provider assigned to them or a care team assigned to them? That is something that's very important when you're dealing with patients in a medical home or specialty practice. The next section or concept is care management and support. And this is really where you're going to identify a patient population to care manage. So these are usually your more chronically ill patients who have chronic conditions such as diabetes, asthma. You choose whatever is based upon your patient population. You will get to choose what population that you want to care manage and develop some sort of care plan to support that patient. So this is the care management area. The fifth one is care coordination and care transitions. And this is really all about managing labs and imaging results and your referrals and care transitions. So you can help minimize the costs, any confusion, and any appropriate or duplicative care that could happen without proper care coordination. So this is what you're going to be looking at for this section. And the last one for PCMH, you're going to have what they call performance measurement quality improvement. So they shorten this and just call it QI. This is, you're going to collect and analyze your performance data. You're going to set some goals for improvement. Maybe you're going to have to look at some clinical goals, some patient experience goals, access goals, healthcare costs, and care coordination. So you're going to analyze and get base data for those types of areas. Then you're going to decide what you want to do to improve and set a goal and make an intervention, and then reanalyze that down the road and decide and see if you've made any improvements. So that's really what you're going to be dealing with in that one. Plus, then you're going to share your results with your practice and your patient population over the work that you've been doing. So everybody, it's a transparent situation. So here, the PCMH scoring, we are looking at 40 core criteria that is required in order to get recognition for PCMH. So there are 40 core criteria embedded into the program, and you're going to have to meet all of those in order to meet the requirements. Plus, you also have those electives that you choose from. Now, there's actually 60 different criteria that are electives that you can complete, but you only need to choose 25 or more of those in order to get recognition. Now, they can be from anywhere in the program. They don't have to be specific criteria. The only thing NCQA requires from this is that you choose electives from at least 5 of the 6 different concept areas. But none of them have to have more weights than the other ones. You don't have to have more in QI than you do in TC or anything like that. You just have to have at least 25 credits within 5 of those 6 areas. So now, as we move into the patient-centered specialty practice program, as you can see, it looks almost identical. There is an additional concept for PCSP, and that's the gray box, the second box there, and that's initial referral management. So with this box, you're going to set expectations for your referrals and care transitions to really ensure timely exchange of information is managed. So since you're a specialist, you're going to be receiving a lot of referrals normally. So they want to make sure that that care coordination piece and set some standards with those people referring into your office are set and meet expectations of what you need and what they need, and make sure the patient's not dropped in the process, because as you all know, that can cause a lot of extra time if you don't get tests that you need or results, those kind of things, or don't know where the patient doesn't know to go where the appointment is, those kind of things. So you need to make sure that this is the biggest change in the area. Now, when I say the biggest change, I want to let you know that NCQA is just now releasing this new model for PCSP. The PCMH new model came out last year, and as we anticipated, PCSP has followed suit, and this is being released beginning July 1st of this year. So if you've not already begun your PCSP program and your preparation to achieve recognition, it's probably, you have a very short amount of time to complete all of the necessary practice transformation necessities in order to get recognition. So you're probably wanting to look at the new model of care that's beginning July 1st. So the other ones I'm not going to go through because the other concept areas also deal with the same things as PCMH. They're very closely related. Now the scoring's a little bit different. It's still achieve recognition the same way. You still have to meet a certain number of core and a certain number of electives. There's just a little bit less stringent for this program. So for core, you have to meet 38 core, and for the electives, you have to achieve 20. Now you have 52 to choose from, but you have to meet 20 out of those. So what happens when you get recognition? What happens? So recognition now for these new programs are based on 1 year recognition, and at the end of the year recognition in the new programs, you will need to renew that, and they suggest starting working on that 2 to 3 months prior to that expiration date of your renewal. So, you know, NCQA engages your practice in an annual check-in, so that's going to be the time for you guys to have an opportunity for you to demonstrate the changes that you've made during the recognition, maybe some new QI projects that you've been working on, those kind of things, to show NCQA at that check-in. So now that you kind of have an overview of the two programs and the requirements, the kinds of things that NCQA is looking for, what are the reasons that you would want to have recognition? So what are some goals and benefits? So really, these programs, I've helped a lot of different clients over the few years achieve PCMH or PCSP recognition. And as we have moved from that fee-for-service based model of care, and we're moved into the value-based model, it really lays that foundation for that. So this is a really good start, a good base to prepare your practice for that. We have seen some improved health outcomes for patients with diabetes, A1C measures, their colorectal screenings have improved, things like that we've really seen make a difference once practices have embedded these processes and criteria into their practice. And they really achieve a true practice transformation. Now, this is a lot of work when you're going through this process, transforming your practice, but I will tell you that at least 90 or 95% of the practices that we've helped, most everybody says, oh, well, we already do that. We just need to write a process. So it's things that you can get credit for that you're not getting credit for now by getting recognition. And it also helps you for the MIPS program with CMS. So if you can get full credit in the improvement activities category, if you do have recognition. Now, they do require that at least 50% of your locations be recognized under your tax ID number. So if you have a tax ID number that has 10 locations, then you would need at least 5 of those locations or more to have recognition for all 10 practices to receive full credit in that category. So what are some practice benefits for getting recognition? So like I said, we have seen some people with some cost savings. There's actually an average gross savings of 7.4% on total medical costs for practices that are recognized compared to a traditional primary care practice. So that is some good news. Competition, like I said, you can advertise if you become recognized to your patients and your community that you do have recognition to be a little bit more competitive in your market. And also, it really helps towards payment reform. Like I said earlier, it really helps align for that value-based payment model and lays that foundation for MIPS and for this value-based world and preparing for advanced alternative payment models. This is, oh my gosh, you have to do all of these things embedded in this program, in these programs, and it really helps to put you in that position for this value-based care and these types of things by having this strong infrastructure and these quality improvement initiatives. So your staff benefits. Well, in this type of model of care, your staff can, work at the height of their licensure with using the skills and their abilities for what they were trained to do and really focus on patient care. And with doing stuff like that, you get higher job satisfaction and greater efficiency because you're going to have improved care coordination, hopefully, and you're going to establish some consistent workflows and processes really to create this efficiencies within these types of care. So we wanted to show you, too, how the NCQA, PCMH, and PCSP program kind of align with the MIPS track. You can see these are some 3 examples of different improvement activities that correlate with the different criteria that are built into PCMH. So these are just 3 out of over 90 or more correlations that we've found in the MIPS program and improvement activities and the PCMH program. So we wanted to show you how closely they are related to each other. So some other benefits. NCQA released an evidence PCMH recognition back in October of 2017. They did a study, and we wanted to highlight 4 of the areas that are shown. So this first blue box here is cutting costs and utilization. So for every dollar invested in PCMH, they found that they saved $6. You can also see there was a reduction in inpatient admissions with 61 to 94 fewer hospitalizations per 1,000. Also, if you look at quality, you can see those improved outcomes that they have found by being PCMH or PCSP recognized, your improvement in A1Cs, your LDLs, those breast cancer screenings, and really those nephropathy monitoring had a huge increase. Not only has it improved with decreasing some cost and improving quality, they've also found satisfaction for their patients. So we found that PCMH is especially helpful for patients with chronic conditions and help care manage with them, and that they found that 73% of their Medicare beneficiaries said that they want this style of care. And with expanding the access section, actually patients, the Medicare patients, 83% of those said it improved their health, and that 51% can actually get same-day appointments as opposed to 13% that cannot get same-day appointments in a traditional type of model of care. So these are just some highlights of benefits if you're interested in learning more about the specific study, we'll be glad to show you how to find the full study, and it lists a multitude of other ones, but these are some highlights that we thought were really important to share with everybody. So, of course, what's some financial incentives by becoming recognized? We really strongly suggest that you reach out to your payer representatives individually and negotiate for higher incentives and better rates based on recognition when you receive that. We know that there are different payers in the state of Kentucky that have different quality programs that correlate and are really similar to PCSP and PCMH requirements. And by having recognition, it may meet those requirements for those quality programs with those payers. So that's why it's extremely important that you speak to your payers and negotiate better rates, because we've seen evidence that this has happened for some of our clients here in the state of Kentucky. Now, one example is Humana has what they call the STAR program. Some of you all may be familiar with that. And this is just one example where patients have negotiated for extra per member per month incentives, because by getting recognized with PCMH and embedding and implementing these different processes into their program that NCQA requires for recognition, it also aligns with the STAR program, and they met those requirements. So we have seen some evidence that this has happened. Now, we anticipate that Kentucky are going to follow 44 other states to eventually have direct PCMH and PCSP incentives based off of this NCQA data. There are private and public payer initiatives together have grown from 18 states starting in 2009 all the way to 44. So unfortunately, we're one of those last states that have a direct PCMH incentives, but we do know there are evidence of people getting financial incentives by speaking with their payers. So that's really important. So now that I've kind of given you an overview of the programs and the benefits and goals of becoming recognized, I want to stop talking. Y'all can quit listening to me, and I'm going to pass it on over to Kristen, and she's going to tell you how the REC can help you all if you're wanting to think about achieving recognition, and how we support our practices moving forward.
All right. Thank you, Vance, for all that information. So as he mentioned, we want to cover how the Kentucky REC can help assist you in obtaining this recognition. So first, we do have patient-centered medical and certified content experts, and that does happen to be Vance and I. So we have been sent off to training, and we've actually taken a quiz or a test to be actual certified in this area. We do provide that individualized assistance, so what works best for your practice, we adapt it to how we can help you obtain that recognition, and then we provide you with education. So what does all the criteria or the concepts or the competencies really mean, and how to implement those into your practices? So we help with providing that background information. And we are a partner in quality with NCQA, so they do give our practices that discount towards some of your fees. So by working with us, you would be able to use that discount that we are offered. And so just some additional support that we are able to offer you. We'll complete gap analysis on behalf of your practices and really review that with anybody that is on the PCMH team. We are experts in this field, and you will receive an expert that is assigned to your practice. So you will have somebody that walks you through the whole entire recognition program. You can reach out to them at any point. Typically we have, meetings every month, or, you could even have them biweekly. It's kind of up to your practice to determine that schedule with your expert. So we'll offer you that personalized support. We can provide some examples of documentation. We're also happy to even review your documentation. And we can also help you in submitting your documentation. So how do you really prove that you could be a recognized or should be a recognized home? That's through all the documentation that you put together. And so we can review that, we can help you upload it, we can show you how that process works. And we can also offer you with some on-site assistance. So we're happy to come to your practice, have a meeting with your PCMH team or anybody that you would like us to meet with and really walk you through this process. We're happy to do all that. And really, our main goal is to break it down into small bits and pieces. It can be quite overwhelming as it's quite a large process or, transformation for your practice, but we're really here to help break it down for you into smaller pieces that are more manageable. Because like I said, it can be rather daunting to take on such a large recognition program, but also, as Vance has mentioned, we do find that you're doing a lot of the information. It might just be that you need to put some more formal documentation together to really prove that you are more patient-centered and could get that recognition. So we just want to let you know that here at the REC, we have assisted over 120 plus practices in pursuing either that patient-centered medical home or, if they're specialists, that patient-centered specialty practice recognition. And 100% of practices assisted by us who have gone on to submit to NCQA were successful in obtaining that recognition. So we're pretty proud about that number, and we here at the REC really enjoy helping practices transform and become a recognized practice. So if you feel like your practice is interested in obtaining this recognition, we just want to provide you with this survey, and it's really for us to determine where you might be in the process of becoming a more patient-centered recognized practice. So if you click on the PCMH/PCSP Readiness Assessment, it'll actually take you straight to that survey. And if you would like to fill that out, it'll be sent to us. We will review it, and then we'll set up a call with you to talk about what you answered on the survey and then provide you with any recommendations or how we see this fitting with your practices and how we can maybe move forward to assist you in obtaining that recognition. And if you are a practice that happens to be on this call and you are already recognized, we just want you to be aware that we do offer that individualized renewal assistance. So it's not quite like starting fresh at recognition. So it's a little bit of a quicker process for you all. But if you get stuck and you're not sure how to renew with NCQA, we are here and we are happy to help you navigate through that renewal process. And that might be new to a lot of our folks with this recognition program. So that really concludes our webinar. We were just wanting to provide you with the background on what exactly is a patient-centered medical home and what is a patient-centered specialty practice, and also provide you with like the goals and benefits and what is all included when we talk about these programs. So if you do have any additional questions, you can call us at the number that's listed on the slide. Feel free to email us as well. And like we mentioned at the beginning, we will be sending out a recording for this webinar if you would like to share it with your staff or anybody at your organization. We do want to move on to our questions, so we'll give you just a minute or two to type some into the Q&A box, and we will be happy to answer those for you. Okay, we did have a question come in, and it looks like they said, my physician is under the assumption that by getting recognition, we will obtain bonus monies. Is that the case? Vance, do you know that answer?
Yes, so when I was talking about earlier about possible financial incentives, this is where it's really important because that is a definite possibility to get some additional incentives, you have to speak directly with your individual payers to negotiate those bonus monies. So it'll depend upon what kind of programs they offer, and we are hoping too in the near future that Kentucky will be one of the 44 other states that also offer direct per member per month incentives. But that has happened too with other payers within the state. They just call them different program names, and that's why you're going to have to speak to that payer individually to negotiate that.
Great. Let's see if we have any more questions come through.
So so there's another question, incentives. Is this incentives from insurance companies like HEDIS? So again, it depends upon the payer, so and incentives that they offer. So that's why you have to negotiate with them on what they can offer by becoming recognized. And you will have to explain like the recognition and what you are doing and showcase the things that you have embedded into your practice with PCMH or PCSP recognition. And a lot of payers are going to be familiar with that, but they may ask some different specifics about the program. And I would have some ready specifics that you've embedded into the program, what you are doing to improve efficiency, improve patient outcomes, those kind of things, in order to negotiate those higher rates.
All right, thank you for answering that. Looks like we have another question that has come through. How long does this take to implement within your practice? And I'm happy to answer that one. Based on what NCQA has always told us, it takes about 6 months to a full year to transform your practice. And I would say that that's pretty accurate, considering all the practices that we have worked with. If you are doing most of the criteria or, the requirements, then you probably could lean more towards 6 months. But if there is more transforming that you need to do with your practice, it might take you a little bit longer to transform your practice to actually submit for that recognition. But I would say shoot for at least 6 months to kind of work through this process. Do you have anything else to add, Vance?
Yeah, that's about a normal scenario average. It varies upon your practice and how large your practice is, how many providers, locations, those kind of things, how long it's going to take to implement. But I did say earlier that we have usually see a lot of practices say, oh, we already do that. We already have same-day appointments or whatever the criteria might be. So it's just a matter of maybe writing a process for that or finding evidence to prove that. So that's what takes the most time. But, yeah, that's
about the average we
yes.
see. All right. It looks like that is all the questions that we do have at the moment. If you do think of questions when we are finished with this webinar or after this webinar, feel free to give us a call. We are here and we are happy to help you answer any of those questions that you might have. The number we provided you, we've given you our email, and we will send the recording out. But we are so glad that you were able to join us on our webinar, and we hope you have a great rest of your day. Thank you.